I look like I'm... Good afternoon, everybody, and welcome to our webinar this afternoon. We are so glad that you all are able to join us. Jeanette, if you can just confirm that you can hear me okay, that would be fantastic.
Yep, sounds great.
Perfect, thank you. Sorry about that, everyone. For some reason, my mic button is not available on my computer, which is kind of weird, which makes it a little challenging to know if I'm muted or unmuted. So thanks so much, Jeanette. Well, welcome to our time together this afternoon. We are going to spend some time this afternoon talking about selecting a topic for quality improvement and running short, rapid PDSA cycles, which I know is a topic that a lot of folks have had some interest in lately and really wanting to have a little bit more of a learning opportunity in this light. So I hope that you're all excited for our time together this afternoon and would invite you to engage throughout the webinar by using the chat box and or unmuting your mic. You all are able to do that, so you can feel free to share thoughts, questions along the way by either voicing them or sending a message in the chat. So just a quick, who am I? Again, this is Robin Vandermeer with the Michigan Public Health Institute, and I'm also joined by Jeanette Ball, who is doing a lot of the behind-the-scenes coordination with Zoom for us today. So thank you so much, Jeanette, and we are really here to chat with you all today about this topic and support your learnings in this area, and are delighted for the opportunity to do so. So just a couple of logistics before I go too far. I already mentioned a few of these things, but we definitely want to hear from you. So don't hesitate to engage throughout our time together. You can do that again by unmuting your phone line and or using the chat. The one thing that we'll point out with the chat is that if you can, when you are chatting, make sure that your chat is being sent to all panelists and attendees. That would be fantastic. You can do that by changing the who your chat is going to in the drop-down menu. So if you look at in the chat feature where it says to, there's a drop-down menu. It always defaults to panelists, but you can change that to all panelists and attendees. So if you could do that so everybody can see what's going on in the chat, that would be fantastic. And just a reminder that we are recording today for those who weren't able to attend live, so that they have the ability to benefit from this webinar as well at a time that works a little better for them. So today we are going to spend some time doing a couple of things. First, we're going to discuss the importance of selecting a topic for quality improvement and approaches for doing so. And then we're going to really spend some good time exploring rapid cycle plan, do, study, acts cycles that build on one another. So how to really think about scaling your improvement efforts so they are rapid and short, so you can take the learnings and build on those learnings to work toward greater improvement in the topic areas that you are focused on. And of course, as always, engage and learn from one another. So we invite you to share thoughts, ask questions, share experiences throughout, and we will get to as many of those as possible during our time together. So I'm going to kick off with talking a little bit about selecting a topic for quality improvement and really the importance of doing so. So selecting a topic is a key focus, as many of you know, of step one of the plan stage of a PDSA cycle. During step one, that is really when you are coming together and considering areas for improvement that you have as a program, as an agency, and working toward focusing on one area of improvement for the effort that you are looking to embark on. And remember that this focus focusing on an area, it can be broad when you start off. That's okay. But it's really critical in beginning to bring focus to a formal improvement effort that you identify a specific topic for quality improvement. It's your initial opportunity to really foster excitement, curiosities, and buy-in for formal improvement efforts. So this is a good time to start to get people on board with your improvement efforts that you're planning to focus on, and a really good time to think about, as you are bringing focus to improvement efforts, how to make them meaningful, and to really connect with staff members' passion projects. And what I mean by that is if you pick improvement efforts that staff who are going to be involved in are particularly excited about, they know that there are challenges with that particular area within your program or particular process that you've been working with for a while, and they're passionate about moving that forward and figuring out how you can achieve improvements in that area, those can be really great places to look towards starting with improvement efforts. And I'm going to get into here some different approaches that you can take as you're thinking forward to improvement efforts that you're going to embark on. So before I dive into some of that, I'm curious, for those of you that are on the line this afternoon, how have you identified opportunities for improvement in your program or in your agency in the past? And you can feel free to chat those in through our chat box or unmute your line and share those verbally. I know we've had some folks that have worked on quality improvement efforts in the past, so I'm going to be comfortable with silence for a few moments and give you all a little think time. It looks like Ben wrote in that they have done this through discussion with staff, usually through meetings, but also at random when items come up that are good areas for the program to look to for improvement. Thanks, Ben. Lynn shared that they look at things that are frustrating to staff or policies that are hard to keep. That's a great way to bring some focus to improvement efforts, Lynn. Thank you for sharing that. What other approaches have you used for identifying opportunities for improvement in your program or within your agency? Well, Ben also shared that they use surveys a lot. Another great place to get some good ideas for potential areas for improvement. Thank you, Ben. Well, maybe as we move forward, others will have some additional thoughts, so feel free to share those through the chat as we keep going. So really, truly, there are tons of different approaches that you can use to identify opportunities for improvement. I'm going to share a couple with you here today, but as you are beginning to see from your colleagues, there are various ways of going about doing this and finding those passion projects of the staff that you're working with within your program, within your agency. So first and foremost, an easy place to look to is reviewing data that you have at hand. That data can be data that you have in relation to performance measures. So examples would be the performance measures for MCV or other funders that you have that you are working with. Looking to standards and measures for the home visiting model that your program is implementing and opportunities within those. Looking to results from model reviews that your program has had and identifying opportunities for improvement within those reviews. And also looking to program level data. So some of you may have some client satisfaction surveys that you've done. Those are always great places to go for opportunities for improvement, and or other surveys of staff members. Sometimes programs do focus groups, kind of so on and so forth, but looking to other sources that you may have that would lead you to some ideas for areas for improvement that you might work on. This next one is surveying staff, and it sounds like we have some folks on the line who have used that method for identifying opportunities for improvement, which is fantastic. You can also engage in formal or informal brainstorming exercises. Ben alluded to this by sharing that some of the ways they've approached this in the past is having a discussion with staff through meetings. Using staff meetings is another great place to start to generate some ideas for improvement, and or looking to supervision sessions. Sometimes staff will bring up processes or opportunities for improvement that they have noted in their work during supervision sessions that as a program you can kind of just keep track of and revisit as a more full staff as people come together. But truly, you know, you're looking for things that are frustrations, and Lynn hinted at this in her response of saying that they really look to things that are frustrating with staff. So frustrations faced by your team, common challenges or barriers that are encountered, any of those approaches are helpful in identifying opportunities for improvement to move forward with. Here are some ideas of various discussion questions that you could potentially use if you're looking for some discussion questions to begin to generate ideas for opportunities for improvement. So you could ask, where is our performance different than we would expect or want? You could ask staff what processes are frustrating or inefficient. You could also ask, what are areas for improvement that you would like to see the team tackle next? All of these are broad and ways to just begin to dive into that conversation and really truly generate a number of ideas that you can work with as a team. And it's a good idea to find a good way to capture those ideas so that you can come back to them. Because remember, with any improvement effort that you're embarking on, you're only going to focus in on one topic area, and really in the end, as you work through the plan stage, a very specific part of that particular process that's in need of improvement. So keeping a running list that you can come back to and tackle for future improvement efforts can be particularly beneficial. This might be something really good to do at the kickoff of a new program year or the kickoff of a new fiscal year as you are getting situated and looking forward to what you want to accomplish as a staff moving forward when it comes to improvement. So what examples can you share of topics for improvement that staff were eager to tackle that have come up within your programs? And again, feel free to chat those in and or unmute your line and share those verbally. And shared self-evaluations. Ben, can you tell us a little bit more about that topic? Is it really completing a self-evaluation or looking into what actually happens within a self-evaluation? For others, what other topics for improvement were staff eager to tackle, excited about? Ben shared that mainly with the self-evaluations was looking to the questions that are on that self-evaluation form. Kind of looking at the process of completing and looking to the information that's captured within a self-evaluation. Thanks, Ben. All right, I know more of you have worked on improvement efforts. I'm going to keep moving us forward, but if you can share in the chat some of the topics that you have worked on or staff are particularly excited about, I think that would be great for generating some ideas among this group. So I'll invite you to do that as we continue to move forward. So once you have some ideas, you've brainstormed some ideas as a team, as a staff of areas for improvement that you might want to focus on, you want to first and foremost prioritize where to start. So when it comes to prioritization, there are a couple of important things to think about. Many times it's good to start with low-hanging fruit, things that are easy to work toward and accomplish that will get you some quick wins as a team. It can also be really good to look to ideas, topic ideas that are common everyday problems that staff encounter, because those will be really meaningful and impactful for your program overall. And again, something that could potentially offer some quick wins for your team and generate some additional buy-in if that's something that you are looking to do with staff that are in your program overall. And of course, also thinking about things that the team and or your staff really feel particularly passionate about. So those passion projects that I talked a little bit about earlier, those can be great places to start. And again, you want to keep your list, hold tight to that, save it somewhere or tuck it away somewhere so you can come back to it as you have needs for future improvement efforts. You definitely don't have to do that brainstorming over and over again. It can be a living document that people add to as you move forward. So you always have potential areas for improvement to come back to. Once you have prioritized where to start, you want to be sure to state the problem or opportunity for improvement that you're going to tackle. And the way that you do that through formal quality improvement effort is to develop a problem statement that truly describes the problem that will be addressed by your team through the quality improvement project that you are kicking off, and really why that project is needed. Some teams find it beneficial to share some baseline data at this point, especially if that's a way that you worked toward identifying topics for improvement, and or sometimes it's appropriate to share particular standards or measures or performance measures that you are being held accountable to as a program that you've noticed that you're maybe following a little bit short on, and that's why you've identified that particular area for improvement. So really making the case for the journey that you're embarking on through your particular improvement effort. So where do you go once you've selected a topic, stated the problem, and you're really ready to dive into your improvement effort? How does this connect with really scaling your improvement effort to something that is manageable, that you can do in a short period of time and learn something and really move those learnings forward in a meaningful way? A couple of reminders. So remember that when you are embarking on formal improvement efforts, so you're chartering a project as a team, you want to make sure that those efforts are data driven. Data is a part of the entire PDSA cycle. You need baseline data during the plan stage. You need to be able to collect comparison data during the do stage. And then you need to be able to look at both your baseline data and comparison data during study and act to determine how best to move forward. And remember, those data can be quantitative as well as qualitative. So, really thinking about both and as you are considering your improvement efforts. You also want to make sure that your effort, your formal effort, is a product of an intentional method. So what we mean by this is that you're using a method for quality improvement to move that effort forward. In this case, you all are very familiar with the Plan, Do, Study, Act cycle, and that's the method that you're using. So you want to make sure you embark on a formal effort using the Plan, Do, Study, Act cycle. You want to be sure that you utilize quality improvement tools at the appropriate time. So when you're thinking about current process, using process mapping or flow charting. When you are doing root cause analysis, using a root cause analysis tool such as a fishbone diagram, force field analysis, 5 whys, so on and so forth. When you're looking toward brainstorming potential solutions later on in the plan stage, making sure you're using a tool for that. So an affinity diagram, a tree diagram, a prioritization matrix, something that will help you generate a large number of solutions to the root cause that you've identified, and really select a solution that is hopefully in the end easy to test. And will have a big impact. And we'll get into that a little bit more here as we talk about rapid cycles. And you want to make sure that you are documenting your journey along the way. So using the quality improvement team charter as your roadmap and having that handy at every meeting and revisiting it and making sure that you are documenting as you go, as well as the storyboard. And really both of those can be used hand in hand. As you kick off your team charter, you can also kick off your storyboard, because your storyboard is sharing the journey along the way, and that's something you can build along the way. A couple of things to keep in mind about formal improvement efforts. They do not have to be complicated, long, or boring. And that really gets into our discussion here today around rapid cycle and how to scale your efforts in a way that they can be rapid and they aren't long, so that folks don't become disinterested in the work that you're doing, and maintain that excitement and buy-in for the long run, and that you are learning about your process, about what's really working well and not working well rather quickly, so you can act on those learnings and move those learnings forward and really achieve meaningful improvement that you are able to sustain for the long haul. So to do that, it's helpful to consider rapid cycle Plan, Do, Study, Act. So what does this mean? So rapid cycle PDSAs are PDSA cycles that are planned, tested, and studied and acted upon in a short amount of time. I'll get into the time piece here in a little bit, but truly when you are embarking on an initial rapid cycle PDSA, you can probably do that in 6 weeks. And that, that might sound kind of crazy to some of you that are used to running much longer cycles, but we're gonna spend some time really unpacking that here together today. And I invite you, as you have questions, to share those or thoughts in the chat, or to feel free to unmute yourself. And really, we're talking about tests for improvement that are small, short, and simple in nature, and really build on one another. And I'm going to unpack this piece more as we move through our time together here this afternoon, so that you can hear a little bit more about what that really means. So why would you consider doing a rapid cycle PDSA? How can this really benefit your work for the long haul? So first and foremost, rapid cycle PDSAs really support the team in keeping your tests for improvement very well defined and short in nature. So they help you think about what can you do in a very short period of time. So what can you learn in a day, and take those learnings and move them forward. So we are many times with rapid cycle PDSAs, actually pretty much all the time, you're talking about looking to process measures, not necessarily outcome measures, but outputs of a process along the way that are getting you to the overall outcome at the end of the day, but are really much more tangible items that can be looked to and accomplished in a short period of time. Rapid cycle PDSAs really allow your team to gather learnings quickly and then move those learnings forward in a way that you're building on the learnings over time, working up to a point where you have really a high degree of comfort that the change that you have tested can be something that you can maintain for the long run and will continue to result in the results that you are achieving through the rapid cycles that you're running. Rapid cycle PDSAs also create space for the team to truly test under different conditions, which is an important part of doing quality improvement work, because as you all probably know, when you are embarking on improvement efforts, there are so many different conditions that pop up that you really need to test thoroughly under to understand whether or not that particular change that you're testing, solution that you're testing, is something that is feasible to maintain and keep in place across staff for the program as a whole. Rapid cycle PDSAs help you maintain that excitement and positive energy because you are moving through improvement efforts in a fairly quick nature, which keeps people engaged and excited because learnings are happening on a very regular basis versus having to wait 6, 7, 8, 9 months to have some tangible learnings that you can move forward with. Rapid cycle PDSAs really increase the chances that the improvement you are making to the particular process that you are working to improve can really be sustained. And honestly, they provide time for staff buy-in. And I'll share a little bit more about this as we get a little further into our time together this afternoon. But as you all know, change is hard. It's hard to get everybody on board and get everybody on board all at once. So this way of doing Plan, Do, Study, Act cycles allows you to build up to really full implementation once you have confidence and evidence that the change that you're testing really is helping you overcome the challenge that you have at hand and can be something that you can sustain for the long term. It's likely that you are going to have staff who test the change early on that you have early buy-in from, giving you time to support staff that may be a little bit more reticent to buying in the change at first, to give them a little bit of time to get there. So when you think about a rapid cycle PDSA, what's really different from what you are likely doing as a program already? If we take a peek at each of the stages, I'm going to share a little bit about what the initial rapid cycle PDSA would look like, what consecutive cycles would look like, and the timing to help you begin to kind of get a picture of what this might look like in your mind. So we take a look at the plan stage. When you are running an initial rapid cycle PDSA as a team, the team is going to spend time planning for the improvement effort, just like you do now with the PDSA cycles that you're running. You want to make sure that you're using appropriate tools to charter the project, that you spend some time looking at your current existing process that you're working to improve, that you spend some time examining root cause and identifying potential solutions based on the root cause of the problem that your team landed on, so on and so forth. When you're thinking about your initial cycle, it's really important to aim for no longer than a month for the plan stage. Now you're probably thinking, oh my goodness, how can we accomplish all of this in a month? Because as many of you know, the plan stage is really one of the heavier lifts when it comes to doing PDSA cycles, because there's a lot contained within the plan stage that you need to work through. And honestly, the best way to get through the plan stage in a month's time is to meet very regularly as a team. So when you're kicking off a PDSA cycle, it can be helpful and is really important to consider meeting weekly so that you can work through the plan stage in an efficient manner. You don't have to spend a lot of time going back and reminding people of what happened at the previous meeting, but can really kind of swiftly work through the different parts and pieces of plan so that you are thoroughly planning for the improvement effort, but getting that done in a condensed amount of time. I'm going to talk through do, study, and act for the initial cycle, and then actually, you know what? I'm gonna share the consecutive cycles for plan with you, and then I'll get into do, study, and act. So once you really thoroughly plan an initial cycle, when you do your consecutive cycles, those are going to be pretty easy because as you will see when I share an example here in just a little bit, your cycles are building on one another. So your entire plan stage for the consecutive cycles really shouldn't be overhauled. You should really use the plan that you worked through for that initial cycle and build from that plan. So you should revisit things like the aim statement, root cause analysis, the brainstorm of potential solutions, so on and so forth. You should tweak, add to as needed. If for some reason your initial cycle resulted in no improvement and your team feels like, perhaps we tackled the wrong root cause, that is a great opportunity to go back to whatever tool it is that you use for root cause analysis and revisit it and think about, okay, which root cause did you tackle, and what other causes might be really weighing heavily on the problem, and how might you need to tackle a different root cause as you continue to work toward improvement in the overall topic area to work towards reaching your aim, so on and so forth. So the timing piece for consecutive cycles, really you can accomplish plan within one team meeting because again, you're using that really good plan that you came up with for your initial PDSA cycle under the area for improvement that you're working within, and tweaking that or revisiting tools as needed to identify a little bit of a different direction for your consecutive cycle. When you look forward to the latter stages, do, study, and act, when we're thinking about initial and consecutive cycles for do, the tests that you do during the do stage should be really short. So they should be things that you can test within a day, within a week, with one family, with one home visitor. And the data that you are collecting and compiling during do, the comparison data that, remember, again, should align with the baseline data that you have and with the goal that you've articulated in your aim statement, should be simple, nothing complicated at all. And for some of you, this may feel a little strange because you're used to testing solutions with multiple home visitors, multiple families, so on and so forth. And I don't want you to worry because you're going to get there with rapid cycles, but you're going to get there in a manner with cycles that really build on one another versus doing it all at once. Rapid cycles really help you stay true to one of the key tenets of doing quality improvement work, which is really testing on a small scale, because remember, you are experimenting with any improvement effort that you're embarking on to see if testing something a little different out leads to improvement in the process that you are working toward improving. And you know, it's not until you get further down the line that you're really looking toward implementing that change in a more permanent manner if it does indeed result in good results. So you want to keep your test small and short and very well defined so that you can learn something quickly and move those learnings forward. So really, the timing for your do stage should be no longer than 1 to 2 weeks. You should be working to a level where you can find something that you can test in a very short amount of time. When we look to the study stage, for both initial and consecutive cycles, you want to make sure that the results can be compared to your baseline data as well as your aim statement immediately. this is something that you all should be really used to. I think for the most part, all of you are used to really looking to study and act within the context of a meeting and deciding how best to move forward with the PDSA cycles that you're running now. This will not feel really any different when you're running rapid cycle PDSAs, and the study and act stage can frankly really be accomplished within one meeting together. So for the study stage, again, you want to make sure that you can look at your data compared to baseline, as well as the goal that you've articulated in your aim statement. And when you get to act for initial and consecutive cycles, the team should really be able to determine how you are going to act immediately and move on to the next cycle. So that can be something as simple as testing under a different condition. So for example, let's say you tested something with one home visitor and they did something a little different with a family. When you move to your next cycle, that same home visitor could test that solution, if it worked really well, with a different family, and that would be a different condition. So it's really kind of simply tweaking and building cycles in that fashion, which again, we're going to get to an example here in a minute that I think will be really helpful to all of you. So this is sort of just a lay of what's going to feel a little bit different with rapid cycle testing. So I keep talking about cycles that build on one another, and this is a really important component of doing rapid cycle PDSAs. And essentially what you are doing is you are building up to a place where you have confidence that the solution you have tested is something that as a program you can maintain and really sustain that change for the long run, and you are looking toward how to really truly implement that change as a part of how you standardly carry forward that particular process within your program, so that you can maintain the improvement that you achieved over time through running rapid PDSA cycles that build on one another. So when I talk about rapid PDSA cycles that build on one another, what do these cycles look like? So there are different types of cycles that you're running over time to really work toward the end state of having a change that resulted in improvement that, again, you can actually implement as a part of your standard process. So look to that existing process that you started with and make it a formal part of that process, and maintain that particular change for the long run as a program. So really, when you're starting out with a PDSA ramp, you are starting out very, very small with small scale tests. Again, these are tests that are happening with a family, a home visitor, during one day. They're very, very focused and very, very small. The follow-up test that you do, so you're going to start somewhere. That's going to be a very small scale test, and then you're going to build from that. So you're going to take the learnings from that first small scale test and build on those learnings. So that, and those will be your follow-up tests. And you want to conduct enough follow-up tests that you are testing under either multiple conditions or tweaking the change to get toward achieving the improvement that you're looking for, to really get to a place where you feel pretty confident that that change is something that you could potentially keep in place as a program and really sustain, so that you can move to that more wide scale testing. So your follow-up tests could be something like, for example, if with your very small scale test, if you started out testing something with one home visitor and one family, you can conduct follow-up tests that, the next cycle that builds after that might be with that same home visitor and a different family. You might conduct another follow-up test that is with a different home visitor and a family that they're serving. kind of so on and so forth. And I'm going to dive into an example here in a little bit to bring this to life a little bit more. So again, the first two levels of the ramp are really focusing in on very small scale tests. And what you're doing here is you are building confidence that the change that you're testing is something that you can really maintain as a program and is working in the way that you're looking toward achieving improvement for the particular PDSA for the particular topic area that you are focusing in on. Once you run several rapid small tests, you get to a point where you are ready to do wide scale tests of change. And this is really where you start involving more staff within the program, more families within the program. And this is probably will feel a little bit more familiar to what many of you have been doing with your PDSA cycles that you've been working on for the last several years. And this is an important part of doing rapid cycle testing, because once you build confidence that on a small scale, the solution that you're testing works and you've tweaked it enough to test that solution in different ways as needed, test it under different conditions, you're really ready to see, okay, we've done some testing in various different ways. Does this really work on a wide scale? Can we really make this a part of our program operations? So you're going to run a cycle, maybe sometimes two, that are really wide scale tests of that particular change. And once you've done a wide scale test, then you really get to the point of implementation of the change. And teams will run many times a PDSA cycle that is really focused on implementation and looking forward to making sure that that particular change that you have tested on very small scale and really ramped up and built on over time will indeed be something that you can maintain for the long run. So let's take a peek at an example to bring this to life, to really show you the difference between those very small scale tests, the follow-up tests that occur, the wide scale tests, and then the implementation of a change. So the change that for this particular PDSA ramp that was being tested, that's focused on, is that home visitors are providing families with age-appropriate and culturally relevant books to use between visits. So for this particular improvement effort, the program was working on supporting families in increasing the number of days that they read, sing, or tell stories with their children. So they embarked on a rapid cycle PDSA effort to work toward testing this change and ultimately in the end implementing the change. So their very first cycle, remember this is the first small scale test that you run, was very, very focused. So for cycle one, they tested this particular change, so home visitors providing families with age-appropriate and culturally relevant books to use between visits, with one home visitor. That home visitor provided one family with an age-appropriate and culturally relevant book to use between visits. And so what they did is the home visitor gave that book to the family, shared the book with the family, asked the family to use the book between visits, and checked back in to see if that book was used between visits. They found that, yes, indeed, it was. So the team decided that, okay, that worked on a really small scale, so how can we test that under a different condition and see if it works, in this case, with a different family? So for their second cycle, the same home visitor provided a second family, so a different family, with an age-appropriate and culturally relevant book to use between visits. So they did that and followed up with that family to see what happened there. So then they got to their second follow-up PDSA cycle and decided, okay, that worked with a second family. So another condition that we need to test this under is to see if this works with a different home visitor, because remember, for the first two cycles, it was the same home visitor that was testing the change. So for the third cycle, a second home visitor, so a different one, provided a family that they're working with an age appropriate and culturally relevant book to use between visits. They wrapped up that quick cycle and decided, okay, that worked. So we need to test at least one more time with a follow-up test under another condition and see how that works. So for cycle 4, they asked both home visitors, so the initial home visitor as well as the second home visitor who had, remember, tested with either a couple or one family at this point, to provide 2 additional families with age-appropriate and culturally relevant books to use between visits and follow up with those families and see how that worked. So what we have here is an initial small-scale test that was conducted through cycle 1, and then you'll note that there are 3 follow-up tests that happened. They found that the first cycle worked really well, so they worked toward testing that change under a couple of different conditions to see how the change would result being tested under different conditions, and found some really promising results. So the team decided that based on the 4 cycles that they had run to date, that they were ready to move forward and really run a PDSA cycle that focuses more on that wide scale testing. So again, remember from the previous slide that I had, that this is the point in time where you are testing this change pretty broadly across your program to make sure that you are still achieving similar results to what you did through those small, well-defined, simple, rapid cycles that you ran for the first 2 types of PDSAs that happen in a PDSA ramp. So for cycle 5, they asked all home visitors in the program to provide families that they were visiting during a defined week. So note here that it wasn't over a month, it wasn't over a couple of months, it was really, they identified 1 week during 1 month to do this, and they asked all home visitors to provide the families that they saw that week with an age-appropriate and culturally relevant book to use between visits and follow up on that to see how that worked. They continued to see pretty promising results from that. So this particular team decided to move forward and do one last PDSA cycle, cycle 6, which really focused on, again, implementing that change as a part of their existing process. So to successfully work through cycle 6, the home visiting program updated their process to reflect the solution that they had been testing for a period of time through these rapid cycle improvements. They asked all home visitors to follow the process change moving forward, and they continued to monitor data to really ensure that those gains that they achieved through the small rapid cycles that they tested over time were maintained for the long run. That giving families age-appropriate and culturally relevant books to use supported families in the end in increasing the number of days that they read, told stories, or sang songs with their child. So I'm going to pause here for a moment and see if there are any immediate questions on PDSA ramps. I know this is a lot to take in. Okay, feel free to chat in at any time as I continue talking with all of you this afternoon as questions come to mind. So I think it's helpful to talk about really some important tips for using the rapid cycle approach. The first and foremost is really to test one small, simple change per cycle. You saw that illustrated in the example that I just shared with you. Through the PDSA cycles that this team is running was running, they were not trying to overhaul their process. They were really looking at something very, very specific and testing a very small change, and working toward a place where they felt like that change was something that they could maintain for the long run, and they could work towards implementing that as a formal part of their process. But remember, you want to keep your test very small and simple, and really test one change per cycle. Another key tenet of using the rapid cycle approach is making sure that you are testing in a way that builds on one another. So you saw how those cycles built out in the example that I just shared. So what are some tips for doing that? You want to first and foremost be sure that you're testing under different conditions when you have a successful test. So that can mean testing with a different home visitor, testing with another family, trying something out during a different week, another home visit. Any condition that you think might affect the results of what you're testing, you want to test under, so that you are building toward confidence in knowing that if that change becomes a formal part of your everyday process, it's something that you can maintain and sustain. So the successful changes you want to make sure are tested under multiple conditions, so that you can really work toward scaling up and eventually implementing that particular change. Really honestly, when you're thinking about tests building on one another, the same goes for, let's say for your first test, you test something, it kind of works. Okay, what did you learn from that particular test that you could move forward, and how can you tweak the change that you're testing in future tests to get closer to what you are hoping to achieve through the rapid PDSA cycles that you're running, and your overall improvement efforts for that particular topic area. That is another route to go. There also are times where you are going to test something, it doesn't work at all. And again, as I shared earlier when we were kind of talking through how the PDSA cycles would feel a little different than what you have likely been doing, you can go back to the root cause analysis that you did. You can go back to the potential solutions brainstorm that you did, and you can select a different root cause to tackle along with a different solution to test, if that is what you need to do. If a test doesn't work at all, then you don't want to stick with continuing to test that change. You really would want to change course. And third, you want to make sure that you're collecting and compiling simple data along the way. So data and information that will help you really understand if the change tested was an improvement. And again, here you can use quantitative and qualitative. And I strongly recommend that you consider process-oriented measures, not outcome-oriented measures, because remember, when you're looking at an outcome-oriented measure, and that is your goal for your PDSA cycle, that is going to take much longer to achieve. So if you have some very tangible process-oriented measures that you're looking at, that'll really help you think through the learnings from each rapid PDSA cycle that you're running. Couple more tips for using rapid cycles. You want to make sure that you have a strong team approach. So like with any quality improvement effort, it's very important to have a team of folks that can support this work, and a team that is really fully functional. So one person isn't carrying the load, but you really have defined roles. Different team members are taking on those defined roles with the improvement effort, and carrying them out over time to make rapid cycle testing as easy as possible for your team. This is not something that one person should do all by themselves, so you want to make sure that you have a strong team. You also, and I alluded to this, want to make sure that you're meeting regularly. When you are getting started, weekly meetings are really important. Bi-weekly can work well too. You want to find what works for you and what you can really fit into your schedule. And of course, always look to best practices. If there are other teams that have had success testing something in an area that you're looking toward for improvement, try testing the change within your team and see how that works out. I'm going to pause for a moment. Carrie shared a question, which I actually think that I answered for the most part, but I want to check back in and see if it leads to any additional questions. But Carrie asked, how would a team handle a situation where additional cycles don't glean a positive outcome? So for instance, if for the first or the second cycle, the second home visitor didn't see improvement, what do you do? That is a really great question. That can lead to running some additional follow-up cycles because remember, we're talking about humans here, and sometimes things don't work the first time you try them out. So sometimes it's necessary to have several follow-up cycles. So if it worked with one home visitor but didn't work with another, if you have an opportunity to try it out with a third home visitor, then try it out and see how that works, to see if maybe it is just something that was tricky for a home visitor to test, or if maybe it was just a week that was an off week. If you're testing something with a family, I mean, families are going to be busy and there's all sorts of factors that play into what they're able to do. So you would want to do a little bit more follow-up testing and or tweaking of that change that you're testing as needed to get to a place where you feel pretty confident that that could work on a wide scale before you move forward with the wide scale testing. Okay. So I'm going to pause and see what other questions there are that I can answer for today. Again, feel free to unmute your line or chat in through the chat box. Well, thanks, Ben. I'm really glad this is helpful. So let me ask this. How will you apply what you learned here today? What are some of your initial thoughts for taking this information forward to the teams that you are working with or working within, and considering how you might be able to do some rapid cycle testing? We have a very quiet group today. I'm going to take the quietness as that folks are really thinking about how to best apply and use this information moving forward. And I am going to invite you to reach out to us as you begin experimenting with rapid cycle testing, and let us know how we can help and support you, whether it be questions that you might have that come up as you begin thinking about how you can use this within your programs, or if you need some support in thinking about how to best make that work. My email address is here. Some of you are connected directly with Jeanette already. You can feel free to reach out to us. As always, we will send out the recording and materials from today's webinar so that you all have these at your fingertips to use moving forward. I can't thank you all enough for taking time out of your busy schedules to join us this afternoon. And as I said, if you have follow-up questions or things that you'd like to hear a little bit more about, please do let us know. And we are also planning to follow up with additional materials as we get them developed to support you all in using rapid cycle PDSAs in your work. Thank you all so much for your time. Hope you have a fantastic rest of your day and take good care.